Contrast-enhanced imaging is vital, but on-site radiologist supervision presents a constant challenge. But a regulatory update changed everything. CMS now permits virtual, direct supervision through 2025. This is the key to expanding your service hours into evenings, weekends, and even holidays. It also means one radiologist can now provide oversight for multiple imaging sites simultaneously. So, how is this implemented? We'll break down the technology, compliance, and workflow for superior patient coverage. Virtual contrast supervision remakes the traditional workflow using secure, high-definition audio and video to connect your team with a radiologist. This connects your facility with radiologists for every procedure, ensuring expert supervision is always available, regardless of location. Consider what this means for your biggest challenge: staffing. This model is made to solve interruptions caused by chronic staffing shortages. Clinics without a full-time on-site radiologist no longer need to delay or cancel appointments. Contrast-enhanced studies can proceed on schedule. The outcome is better resource use and continuous patient access to necessary imaging. It removes the supervision bottleneck. But this raises a hard question for any administrator. How does a remote radiologist satisfy the strict requirements for direct supervision and safety? Let's examine the CMS rule. The change redefines direct supervision. CMS now permits a provider to be immediately available via real-time audio and visual tech. Properly implemented systems are constructed to meet this specific standard. This ensures you are fully compliant with both CMS and ACR guidelines. Beyond compliance, what about safety? Virtual systems include rigorous preparation for your on-site team to manage contrast reactions with precision. So, the model works by combining regulatory-compliant technology with an empowered, expertly guided on-site staff, ensuring safety is never compromised. This system also supports your radiologists. By reducing the physical burden of managing reactions, it allows them to focus on reading studies and diagnosis. We've seen how it works and why it's safe and compliant. Now, let's look at what this makes possible in practice. Application 1. Extend patient care. Outpatient facilities can offer evening and weekend appointments, boosting revenue and access. Application 2. Network efficiency. A single radiologist supervises studies across an entire network, maximizing your most valuable resource. Application 3. Subspecialty access. Need pediatric or cardiac expertise? Virtual supervision brings the right specialist to any location, instantly. Consider your facility's own bottlenecks. Which of these applications could solve your most pressing coverage problem? But successful implementation is about more than technology. It demands process. Standardizing workflows across all sites is critical for efficiency. There is also a significant financial component. This model directly reduces costs tied to on-site personnel like salaries, overtime, and travel. When you combine flexibility, compliance, and cost-effectiveness, it becomes a powerful fix for common operational headaches. We've seen the regulatory, clinical, and operational pieces. But how do they connect to create a truly resilient and future-proof imaging service? Here is the connection. The CMS rule isn't just a regulation. It's the key that solves the staffing shortages we identified at the start. And the ability to cover multiple sites when paired with specialist access means you're no longer just filling gaps. You are upgrading care across your network. This is the ultimate advantage. Virtual supervision changes patient coverage from a location-based liability into a flexible, network-wide asset. So, the resilience we asked about comes from this potent combination, using regulatory change to create a scalable, expert-driven, and efficient system. Let's bring it all together. We've established that implementing virtual contrast supervision directly leads to superior patient coverage. It does this by solving staffing shortages and extending hours, all while ensuring the highest standards of safety and regulatory compliance. It improves efficiency, reduces costs, and supplies a significant strategic advantage in a competitive healthcare market. The regulatory window is open, the technology is proven, and the need has never been greater. The time for action is now. Ready to remake your patient coverage? Learn more about how to implement a compliant and effective virtual supervision program for your facility. Visit our website or check out our implementation guide to get started.